Acute coronary syndrome. Acute coronary syndrome refers to any group of symptoms attributed to a strap of the coronary arteries. The most common symptom or problem in the nexus of this acute coronary syndrome is the chest pain, often radiating of the left arm or angle of the jaw, pressure-like in character and associated with nausea and sweating. Acute coronary syndrome usually occurs as a result of one of the three problems: ST elevation myocardial infarction, non-ST elevation myocardial infarction, or unstable angina. Signs and symptoms. The cardinal symptom of decreased blood flow to the heart is chest pain, experience of tightness around the chest, and radiation to the left arm and the left angle of the jaw. This may be associated with diaphoresis, nausea and vomiting, as well as shortness of breath, in many cases of sensation as typical with pain experienced in different ways, or even being completely absent, which is more likely in female patients, and the nose with diabetes. Some may report palpitations, anxiety, or a sense of impending doom, and a feeling of being acutely ill. The description of the chest discomfort as pressure has little in aiding a diagnosis as not specific for acute coronary syndrome. The electrocardiogram is the setting of acute chest pain. The electrocardiogram is the investigation of the most reliable distinguish between various causes. If it indicates acute heart damage, elevation in the ST segment, near left bone bark block. The treatment of the heart attack in the form of angioplasty of thrombolysis is indicated immediately below. In the absence of such change, it is not possible to immediately distinguish between an unstable angina and non-stable angina. The imaging and the blood test as the only of the many potential causes of the chest pain. The patient usually has a number of tests in the emergency department, such as chest X-ray, blood tests, including myocardial markers such as troponin I or T, and HFA-BP and or RD dimer if a pulmonary embolism is suspected, and telemetry. The prognostic scores, the ACI and TP score, can be used to aid diagnosis using 7 variables from the admissions record. This score predicts truly which patients are likely to have myocardial ischemia. For example, according to a randomized controlled trial, males have chest pain with a normal or non-diagnosed ACG, or a higher risk from having acute coronary syndrome than women. Prevention. Acute coronary syndrome often reflects a degree of damage to a coronary by atherosclerosis. Primary prevention of atherosclerosis is controlling the risk factor, healthy eating, exercise, and treatment for hypertension and diabetes. Avoiding smoking and controlling cholesterol levels is in patients with significant risk factors. Aspirin has been shown to reduce the risk of cardiovascular events. Secondary prevention is the use in myocardial infarction. That's treatment. We can have STMY or no STMY. And that's all. That's the English tutorial. Thanks for your attention. Teacher Licenciado Moscoso, it's medicine.